Good afternoon, everyone. We have good news today. I think a number of things that are particularly good. We'll first start off by saying happy birthday to Ohio. 1803, the state legislature met for the first time in Chillicothe. So this is our 218th birthday, and happy birthday, Ohio. Next item, this is March 1st, and we said that on March 1st, we wanted to have every school back in session, either in session completely during the week or at least part of during the week. And I'm very happy to report that we've made some real great progress in regard to this. We told every school that we would vaccinate your school personnel if the school would agree to go back into session by March 1. We've now vaccinated about 200,000 school personnel K through 12. It was done in a 4-week period of time, and I thank all our partners who helped us get this done, all the school personnel who made this happen as well. So that has been accomplished. If you look at where we were back at the beginning of January, in January, 50% of our public school students were not in person. They went to schools that were not offering in-person learning at all, 50%. Today, that number is less than 10% of the school population. And if you break it down by school districts, we have 609 public school districts in the state of Ohio. As of today, there are only 8 of those that are not back in session. Of those 8, 7 will, within the next few weeks, come back into session. So this has been a very successful program. We're very happy about it. We want to thank our teachers. We want to thank all our students, all school personnel, and it's a very good thing. Very happy about that. We have another piece of good news. I'm going to let the Lieutenant Governor talk about this, or ask him if he would talk about it. But Site Selection Magazine today announced that Ohio ranked number one in its Governor's Cup 2020 State Economic and Business Attraction Ranking. Lieutenant Governor, you want to talk a little bit about that?
Yeah, Governor, it's great news. You know, with 2020, we didn't know what the economic development impact would be in our state, around the country, but we stayed aggressive with our partner Jobs Ohio, and really tried to focus on continuing to do deals, trying to get things moving forward, focusing on the fact that we were going to come out of this, and you know, what state did you want to be? And we kept saying, look, Ohio is very competitive as being a great pro-business environment, but also a great pro-worker environment. And we were developing talent and continuing to create a state with a very diverse economy. And what Site Selection Magazine did is they do this assessment, and it's based on new business projects with significant impact, including headquarters, manufacturing, R&D operations, logistics sites, and others. And they ranked Ohio number 1 in per capita deals done. They even put you, Governor, they had a picture of you driving the car that they had showing that we were leading the country. And it's great news. Now, we know that we've had a lot of big things that we've done with innovation districts and retention of headquarters like Sherwin-Williams and Cleveland. But I found this also interesting that as far as our regions, Toledo tied for number 1 for total projects in areas with populations between 200,000 and 1 million. These are, you know, metro areas. Additionally, Dayton Kettering ranked number 5, and Akron tied for number 10. So it wasn't just in the big areas of the state. It was in our medium-sized cities, and it was in our rural communities that we got deals done, and we're able to get the number one ranking and earn the Governor's Cup, which has been done in the past, but in Ohio. But this was welcome news coming out of the pandemic, because we didn't know what was going to happen in 2020. And it's nice to see that when you measured it with where businesses were investing, Ohio was #1. So congratulations, Governor, and good news for Ohio and for the people of our state, because that should mean with these capital investments that come in 2021, the jobs will eventually follow.
What is great news, Lieutenant Governor, and we're very happy about that. We need to celebrate that as well. It is great news for the people of the state of Ohio. More good news. I talked about being on offense against this virus, and what puts us on offense really is having the vaccine. We have more vaccine coming in to the state of Ohio today, tomorrow, Wednesday, and Thursday. As everyone has heard, Johnson & Johnson is now starting to ship, and we're very excited about that. Ohio will get 96,100 doses, 96,100 doses in the first week. So we're very happy about that. If you look at the total number of doses that we are receiving this week in Ohio, again, for the next spread over 3 or 4 days, that number is 448,390 to be exact, doses coming into the state of Ohio. This is by far the most doses, more doses than we received in any other week. We're very excited about this. The Johnson & Johnson, we are sending the Johnson & Johnson vaccine to over 200 independent pharmacies around the state. Most of these pharmacies have not received any vaccine. So if you live close to an independent pharmacy, this will be an opportunity to stop in there or call them and make that appointment to get that vaccine from your local independent pharmacy. We're also sending these Johnson & Johnson vaccines to our local health departments, to our hospitals, as well as to some of our chain pharmacies. So it's going out, as I said, 96,100 doses. It's going out around the state of Ohio. Eric, let's take a look at our map. This map represents where people are able to get the vaccine today. And we have expanded dramatically the number of actual locations where people can get this vaccine. So we are over 1,200 locations in the state of Ohio now. As you can see, they're not only in every county, but just everywhere throughout the state. So more vaccine and a lot more locations. I want to take a moment to talk about this map. When we first started making plans for vaccine distribution, one of our goals was to make it as easy as humanly possible for people to get it and to be close at home, close to your home. We placed at that time vaccine in all 88 counties so that Ohioans would not have to travel a long way to get a shot. Just a few months ago, we had about 750 providers. This week, we've increased that number, as I said, to more than 1,200 providers. That number includes local health departments, hospitals, federally qualified health centers, independent pharmacies, as well as chain pharmacies. If you want to take a look and see the list, you can find that on coronavirus.ohio.gov. That's coronavirus.ohio.gov. You can search by county. You can search by zip code. It will show you where you can go online with the website of a particular pharmacy, the phone number, as well as the location. And I said pharmacy, I meant actually providers. Any of the providers can show you that. What we're seeing is that there still is a significant demand for the vaccine, but we're seeing some space in there. We're seeing some openings and some opportunities. We talked about this on Friday, and I said, now's the time. If you've not been able to get a vaccine, now's the time. If you qualify, you should be able to get that vaccine. We looked this morning just at a few kind of randomly at a few places. We checked Giant Eagle, we checked Kroger, Walmart, Discount Drug Mart, and a few other places. And just to give you an example, in Norwood, there were 34 provider locations with vaccine within 10 miles. Zip code 45337, Maumee. We checked today 33 provider locations who had vaccine within 10 miles. And if you look at tomorrow for Mercy, Toledo, and Lucas County vaccination site, this big vaccination site in Maumee, 2,000 vaccination appointments are available for tomorrow. 2,000. Eligible individuals can schedule through the Lucas County Health Department at lucascountyhealth.com/COVID vaccine. That's again, Lucas County Health, one word, lucascountyhealth.com/COVID vaccine. 2,000 there. In Youngstown, we found 23 providers within 10 miles that had vaccine available. Xenia, Ohio, we found 8 providers within 10 miles who had vaccine in stock. Lancaster, 4 provider locations within 10 miles with vaccine in stock. Athens, 4 provider locations within 25 miles with vaccine in stock. Huber Heights, 28 different providers within 10 miles. And Warrensville Heights, 41 providers within 10 miles. Downtown Columbus, I don't know if I read that, but 34 locations within 10 miles. So again, how do you do this? Obviously, you can go online. You can also, with the over 200 new local pharmacies, our locally independent pharmacies, you could walk in to those in your community. Local health department, you can always call the local health department. You can also call the area agencies on aging, or you can call 211. Many people are used to dialing 211 for critical services. You can call 211 as well. Now, because of the additional doses and because of what we're seeing as far as the uptake, there's still significant demand out there. But frankly, we felt, knowing all the new vaccine that is coming in, very significant increase, and that there's available vaccine in a number of sites right now in Ohio, we felt it was time to expand the group that is eligible. And so let me start with phase 1C, what we're calling our 1C vaccination program, phase 1C. Individuals who have additional medical conditions that may increase a person's risk of severe illness and death from COVID-19. That is one group. The next group is those in certain occupations, which I'll talk about in a moment. Let me talk, and then I'll flip it over to Dr. Vanderhoff, and he can explain it from a more medical point of view. But what we're calling phase 1C medical conditions include the following. So we are adding these to the medical conditions that we have already used. Type 1 diabetes. Most people develop type 1 diabetes before age 21 and are completely dependent on insulin therapy from day one. In contrast, type 2 diabetes is more common among adults and is largely accounted for by our age-based approach to vaccine eligibility. So at this point, type 1 diabetes, we were requiring that someone had been hospitalized. We no longer require that. So anyone with type 1 diabetes. Next, women who are pregnant. Obviously, the age group does not cover them, and we felt that it was the right thing to do to cover them. You have 2 lives at risk, and Dr. Vanderhoff will kind of explain the medical situation in there. Again, no one's required to take this, but this is a group that we are making eligible today. The next group, the third group, those who have had bone marrow transplants. A bone marrow transplant, treatment reserved mostly for people with certain cancers and anemias and performed at specialized transplant centers. Again, Dr. Vanderhoff will talk a little bit more about that. Finally, we are clarifying that ALS or Lou Gehrig's disease is a qualifying severe neurological condition, even though its age of onset may be quite variable. It was the intent to include ALS. We did not spell that out. We are spelling that out today in response to some questions that I have received. Again, these are medical conditions that increase the risk of severe outcomes or death from COVID-19, but aren't covered in our age-based approach. Doctor, we'll turn it over to you to talk a little bit about these different groups.
Well, thank you, Governor. As you noted, beginning with type 1 diabetes, most people develop type 1 diabetes before they're adults. And as you also noted, they require injectable insulin therapy right from the start. So if you developed diabetes later in life, or if your doctor first began treating your diabetes with a pill, you probably have the much more common form of diabetes known as type 2. And as the governor noted, for now, we're asking type 2 diabetics to receive vaccination with their age group. Secondly, pregnancy. Although the actual risk of severe illness and death from COVID-19 during pregnancy is low, it's higher than that for non-pregnant people of the same age. You see, if you're pregnant and get sick with COVID-19, you're at higher risk for being hospitalized in an intensive care unit and for requiring the help of a breathing machine. And in turn, that places you at higher risk of death. Research also suggests that having COVID-19 during pregnancy might increase the risk for premature delivery or premature birth for your baby. Now, of course, we recommend that if you are pregnant and considering vaccination, you first discuss the benefits and risks of vaccination as you would for any treatment or vaccination with your doctor. The governor also noted bone marrow transplant. These are sometimes also called hematopoietic stem cell transplants. And these patients, as the governor noted, are undergoing treatment primarily for cancer and certain anemias, and they face an increased risk of severe COVID-19 illness. This category, I want to make clear though, does not include the kind of stem cell injections people might receive for the treatment of orthopedic problems, especially for their knees. And then lastly, amyotrophic lateral sclerosis, ALS, also known as Lou Gehrig's disease, is a very serious, though very rare condition with gradually increasing weakness and muscle wasting. And that eventually leads to paralysis and early death. It's a very serious condition of the neurologic system. And as noted, we are clarifying that it is included among our serious neurologic conditions. Thank you, Governor.
Doctor, thank you very much. In addition, we're going to talk about several different occupations that we are adding today, again, as part of 1C. Law enforcement officers as well as correction officers. This group will include sworn law enforcement officers and peace officers who have first responder or direct supervisory responsibilities. These individuals must be active duty, working a regular minimum of 20 hours a week. They don't include retired special or reserve officers. Examples of individuals that are included are police officers, sheriff's deputies, Ohio State Highway Patrol troopers, other state or federal officers, such as Ohio Department of Natural Resource Enforcement staff, pharmacy board investigators, BCI agents, state fire marshal employees, federal transportation security officers, and other federal law enforcement officers who do not have access to vaccination from federal sources. Some do, apparently, and some don't. We want to cover all those federal officers and make sure that they have vaccination. This group also includes correction staff. That means probation, parole staff who provide direct services to an adult or a juvenile inmate or court supervised individual. Basically, it's those who are dealing with those who are incarcerated. This group will also include individuals who have a valid active firefighting certificate in the state of Ohio, who are active employees of a recognized fire department. This does not include retired, emeritus, or reserve individuals, and it does include volunteer fire departments as well. Our next group, child care. This includes lead and assistant teachers and substitutes who are enrolled in Ohio's professional registry, who are currently working in open child care and pre-kindergarten programs. This will also include licensing specialists employed by the Ohio Department of Jobs and Family Services or county job and family service agencies. This phase does not include parent volunteers, board members, or owners, administrators that don't provide in-classroom support. We expect about 40,400 Ohioans to fall into this category. Also, funeral services. This group will include embalmers, morticians, funeral home directors, crematory operators, and apprentices. We estimate that this to be about 3,600 individuals. The grand total of those individuals who are eligible under this expanded, this 1C, is approximately 246,000 individuals. Also, and let me just conclude that will go into effect Thursday. This will go into effect Thursday. So any of these individuals who I have just named in 1C will be eligible beginning Thursday morning. Also, Thursday, March 4th, we will go to phase 2. Phase 2 of our program will begin and will include those 60 years of age and over. 60 years of age and over. So we're lowering the eligibility to 60. Anybody above 60 is eligible. And again, this will go into effect on Thursday. 93% of our deaths are those 60 and above. 93% of our deaths. So the age numbers are just very, very critical. 2/3 of our hospitalizations have occurred with those 60 years of age and over. We look forward to making more announcements as we move forward. We had stayed on 65 for almost a month or close to a month based upon all the facts that I talked about, the additional vaccine coming in and the openings that we were seeing in reservations for vaccinations. We felt it was time to make this expansion. Phase 2 has 695,000 individuals potentially eligible. So if you put the two together, you see we're slightly over 900,000 in the groups that we are opening up today. I want to recognize all the volunteers out there. This morning, as I was talking to the different health departments, a number of them just remarked at the amazing volunteers who it's taken to get this job of vaccination done, both the medical personnel and non-medical. People who have stepped up, donated their time to help their fellow citizens. We're very, very grateful for everything that they're doing. Eric, let's go and look at some of the numbers real quickly. Cases continue to be a lot less than they were a few weeks ago. Sadly, our deaths just continue. 49 reporting this day. Hospitalizations, 103. That's a little bit under the 21-day rolling average. and our ICU admissions are right at what the 21-day average is. Eric, let's look at the next slide, please. This is all 88 counties ranked by highest incidence. What you'll see down in the bottom right-hand corner is more of the counties that are in white, and those are the counties that are now below the case number that the CDC considers high incidence. So the rest of them are above high incidence. These counties are now below. So very happy to see that. Eric, we'll look at the next one. Jefferson, Morgan, Athens. Those are now our highest counties, about 3 times what the CDC says is a high incidence. So again, these numbers are coming down, but if you look at the top 20, these are still very, very high numbers as far as spread is concerned. Eric, let's look at the next one. You'll see hospital admissions continue to generally go down, although if you look at the number reported from yesterday's hospital census, you'll see that that is actually up by 20. But the trend line, the general trend line has continued, and it is good, certainly going in the right direction. Eric? Well, today we have an announcement in regard to Ohio Department of Jobs and Family Services Director Kim Henderson. Kim was married recently. Congratulations, Kim. She and her husband are relocating to North Carolina this spring. In order to help create a smooth transition, she will remain in the director's role until next Monday, March 8th. At that time, our current Director of Administrative Services, Matt Damschroeder, will move in as interim director at Jobs and Family Services. Director Henderson will become a senior advisor to him until her last day on April 30th. We will begin a nationwide search for Director Henderson's permanent replacement. Until that search is completed, Matt Damschroeder will provide steady leadership. At DAS, Matt's current assistant director, Matt Watley, will become interim director. Director, thank you very much for joining with us. Again, congratulations on your marriage and your relocation. So we'll turn it over to you. Thank you.
Thank you, Governor. I know ODJFS will be in great hands under Director Damschroeder's leadership. It's truly been an honor to serve on your cabinet, and I'm grateful to have been given the opportunity to lead such a talented and committed team at ODJFS. They are serving a record-breaking 3 million Ohioans right now, and I'm so proud of their work. I'm also thankful for the partnership of the 150 plus local agencies that help administer our workforce and health and human services programs. I'm deeply grateful for the encouragement and support of my husband, Eric, and my family and friends at home, my friends on cabinet, and on the governor and lieutenant governor's executive team. I'm headed to North Carolina in May, but Ohio will always be my home. Thank you.
Well, Director, good luck to you. Thank you very much for your service. We're very grateful. The Director worked with me for a time when I was the Attorney General, and so we appreciate all your service and our very best wishes to you. Lieutenant Governor.
Thank you, Governor. I wanted to just touch base a little bit and make Ohioans aware of what's happening with the $1.9 trillion COVID relief bill that passed through the U.S. House of Representatives in recent days. There's no doubt that the plan provides significant additional relief funding for state and local governments. However, there's a provision in here that I want to raise an issue with, and that's the fact that the relief bill, which provides $350 billion to state and local governments, uses a formula that incorporates the state unemployment rate for the fourth quarter of calendar year 2020, instead of using the straight population-based formula that is traditional in most bills of this nature, and was certainly used in the previous CARES Act. In doing this, it really puts Ohio and a lot of states at a disadvantage in terms of the funding that comes from this. Ohio would disproportionately and negatively be impacted by our numbers that they're using this on. Basically, it goes all the way back to December of 2020, where we had a 5.5% unemployment rate, which would rank us 21st. The funding, if in terms of funding, if it were based purely on population, we'd get the 7th most. We'd be ranked 7th in terms of funding. To put this in perspective, this proposal, because of this formula that's being used based on unemployment, Ohio would lose over $800 million, $800 million as compared to an equitable population-based formula, which has been used in the past. And I want to highlight the fact that Governor DeWine and governors from across the country signed a letter releasing a joint statement opposing the new standard for the federal stimulus bill and how it would be allocated for the states. I want to say this about it. It really punishes states who've been trying to do this right. The states that have tried to find a balance between protecting the health of its people from the pandemic and also protecting people's economic health, trying to get them back to work where it was safe and manage this pandemic in a thoughtful way that finds that balance. And doing things that put people back to work actually are going to cost us relief dollars that the people who aren't back to work actually need. And we don't feel that this is a fair way to do this. And I also might add this, that in this country right now, all 50 states are experiencing a tremendous amount of attempts at fraud, which has been going on throughout this process. And I also believe that that unemployment number is an unreliable number also for that fact. So for those two reasons, I just want to raise the issue, know that we will be wanted to make sure that our U.S. senators knew, Senator Brown and Senator Portman, and we ask that the Senate and our senators help fix this legislation that came from the House that would punish Ohioans, frankly, for going back to work. And we need their help. So, Governor, just wanted to highlight that point and turn it back over to you now.
Great. I signed that letter, and I think, it's not fair. And we hope that the Senate will take care of this problem. So